Welcome everyone to today's presentation on hemodynamic disorders, thrombosis, and shock, based on Chapter 4 of BRS Pathology. In this session, we'll break down the key concepts in this chapter to help you grasp the mechanisms and clinical implications of these conditions. Introduction to Hemodynamic Disorder. Speaker notes: hemodynamics refers to the study of blood flow and pressure within the cardiovascular system. Disorders in hemodynamics can lead to severe clinical outcomes. Today, we'll explore 4 key disorders: edema, which involves fluid accumulation; congestion, or increased blood volume in tissues; hemorrhage, the leakage of blood from vessels; shock, a critical state of circulatory failure. These disorders form the foundation of many cardiovascular and systemic diseases. Edema is the abnormal buildup of fluid in tissue spaces, which can result from various mechanisms: increased hydrostatic pressure, often seen in heart failure or venous obstruction; decreased oncotic pressure, common in liver disease or nephrotic syndrome; lymphatic obstruction, as in infections like filariasis; sodium retention, which occurs in renal disorders. Edema can be localized, like in one limb, or generalized, as seen in systemic conditions like heart failure, where it becomes more severe and widespread. Congestion is the accumulation of blood in tissues due to impaired venous return. It can be active, with increased arterial flow, often in inflammation; passive, due to obstructed venous return, as seen in heart failure. Examples include pulmonary congestion in left-sided heart failure, leading to fluid buildup in the lungs; hepatic congestion, associated with right-sided heart failure or cirrhosis, resulting in a nutmeg liver appearance. Understanding the difference between active and passive congestion is critical for clinical diagnosis. Hemorrhage refers to the escape of blood from vessels into surrounding tissues or spaces. It may occur due to trauma, damaging vessel integrity; rupture, often caused by hypertension or aneurysms; coagulopathy, where clotting mechanisms fail. Hemorrhages can be classified by size: petechiae, pinpoint bleeds; ecchymoses, larger bruises; hematomas, localized blood pools. We'll also discuss the implications of internal hemorrhages, such as in body cavities, which can be life-threatening. Thrombosis is the formation of clots within vessels, a process governed by Virchow's triad: endothelial injury, often from atherosclerosis; hypercoagulability, which may be inherited, e.g., factor V Leiden, or acquired; abnormal blood flow, including stasis in atrial fibrillation or turbulence in arteries. Thrombosis can occur in arteries, where it leads to ischemia and infarction; veins, where stasis and fibrin contribute to clots, as in deep vein thrombosis, DVT. The outcomes of thrombosis depend on its location. Arterial thrombosis can cause myocardial infarction or stroke due to ischemia. Venous thrombosis can lead to pulmonary embolism, PE, if a clot dislodges and blocks pulmonary arteries. DVT is a common precursor to PE, highlighting the importance of timely prevention and treatment of venous thrombi. Pulmonary embolism is a severe complication of DVT, where a thrombus travels to block pulmonary arteries. Risk factors include immobility, such as post-surgical bed rest; hypercoagulable states, from genetic or acquired conditions; trauma or recent surgery. Symptoms range from mild shortness of breath to sudden death. PE can cause right heart strain, circulatory collapse, and hypoxemia. Shock is a state of inadequate blood flow leading to tissue hypoxia. It is classified into 4 types: hypovolemic shock, due to fluid or blood loss; cardiogenic shock, from heart pump failure; obstructive shock, caused by blockages like PE; distributive shock, characterized by abnormal vascular tone, as in sepsis or anaphylaxis. Understanding these types is critical for determining appropriate treatments. Shock begins with hypoperfusion, causing inadequate oxygen delivery to tissues. This results in cellular energy deficits and mitochondrial damage. Inflammatory mediator release, worsening tissue injury. If untreated, shock progresses to multi-organ failure, commonly affecting the liver, kidneys, and lungs. Shock is diagnosed through clinical signs such as low blood pressure and tachycardia, supported by lab findings like elevated lactate. Management focuses on fluids to restore volume in hypovolemic shock. Inotropes to improve cardiac output in cardiogenic shock. Treating the cause, such as antibiotics for septic shock. Timely intervention can prevent organ failure and improve survival. To summarize, hemodynamic disorders include edema, congestion, and hemorrhage. Thrombosis and embolism can cause ischemia and infarction. Shock represents a failure of perfusion, requiring urgent management. Mastering these concepts provides insight into many critical conditions encountered in clinical practice. This presentation is based on Chapter 4 of BRS Pathology and additional clinical references. Understanding these concepts is vital for both theoretical knowledge and practical application in medicine. Subscribe for more educational videos.